Well, I am happy to be back, and thank you so much for coming to listen to what I have to say today. So, I come from Columbus, Ohio, and I'm president and founder of Wellness Forum Health, and our company specializes in informed medical decision making. It's a practice specialty that we invented. And I'll tell you what that means. What that means is that consumers should buy healthcare the way they buy everything else. I want you to think about this for a minute. When you go to buy a car, what do? You check out online, you do a lot, you ask friends, you look up warranties, you do some research, right? In fact, I've been in business for 22 years, and I've never had somebody pull up in a new car into my parking lot, and I said, boy, you got a new car. Yeah, I hate it, but it's the salesman told me I had to drive it, right? And how do you buy houses? I mean, do you just basically let the realtor choose? Do you say something like, you're so much smarter than I am about real estate, so you just pick out a house for me and tell me where to show. And I don't need to read those mortgage documents. I mean, that stuff's crazy. You guys know more than I do. Just tell me where I'm going to be living. You know, people invest more energy in researching before they buy a blender than before they have major surgery. And this is a problem, because when I'm open every afternoon for practice, here's what I hear all the time. If I had known then what I know now, I never would have, and you can fill in the blank, all right? So our business is helping people to look at the evidence, filtering everything through a stated evidence filter. We have 23 criteria by which we evaluate evidence, and then people can look at diets, supplements, screening tests, diagnostic tests, drugs, and procedures, and decide on their own what's best for them. And I tell people every day, doing informed decision making isn't doing what I say, even if you think I have better ideas. It's doing what you think is right after you've looked at the evidence. How many people think that that would lead to better health care? And people would be happier about their choices if they knew what they were doing, all right? So that's basically what we do. And what we want to get people away from is, if I knew then what I knew now. And I'll tell you this very interesting thing about informed medical decision making. It leads to a place that I think everybody here would like to see more of. People decide to adopt a plant-based diet. And I'll tell you why. When somebody has cardiovascular disease, coronary artery disease, we go right to the drug company's website and show them Crestor will reduce your risk of a heart attack or stroke by 1.2%. Do you think most people know that? They don't. Well, you know this diet starts to look really, really good, the plant-based diet, when you know that some of the drugs and procedures are not as effective as you might have thought. So basically today, what I'm going to do is I'm going to talk to you about autoimmune diseases and their causes. It isn't just diet, some other things too, but you have to change your diet if you're going to recover or stop the progression of these diseases. And then we'll have some time for Q&A. One thing I'll mention, paring this down was very difficult for me. I teach a course through our school on autoimmune diseases that includes 24 hours of lectures and another 15 or 20 hours of lab discussion, patient experience, et cetera. And so I had to condense that down into 90 minutes, which means that I will have to talk very quickly, all right? So anyway, let's go on ahead and get started. So the first thing is, like all diseases, the incidence of autoimmune diseases is increasing, not decreasing. 8% of Americans have been diagnosed with at least one of them. 250,000 new cases every year. And one of the things that is the most distressing to me is the number of children who are being diagnosed with autoimmune disease. The average age of diagnosis is going down. There are over 100 autoimmune diseases, but 97% of those that are diagnosed are one of these here. The immune system, just the definition of autoimmune, is when your immune system no longer has the ability to tell the difference between bacteria, viruses, and your own cells. So the body, the immune system malfunctions and becomes interested in your pancreas or your liver or your thyroid gland or your joints. Multiple autoimmune diseases are very common. In fact, one of the things I tell people who consult with me is that our first goal is to stabilize you so that the one you have doesn't get worse, and maybe we can even reverse it. But the most important thing is to make sure that, for example, if you have Hashimoto's thyroiditis, you don't end up being a hypothyroid patient who also has type 1 diabetes. If an autoimmune patient lives long enough, he or she will almost certainly develop more autoimmune diseases. So what are the causes? And we're going to talk a little bit about all of these. One is genetic susceptibility, but it's not as strong as you might think. Hormones and hormonal fluctuations. It's the reason why women develop most autoimmune diseases. 78% of all diagnoses are in women. Diet is right up there with the top causes: leaky gut, chronic infections, chronic inflammation, asthma and allergies, overweight, obesity, and vaccinations. So if we look at genetics, genetics is the favorite thing to blame diseases on. And the reason I don't like this is, first of all, the evidence doesn't support it. But just as important, I think if you think that genes determine your health outcomes, it puts you in a pretty helpless situation. Because I don't know about you guys, but I didn't get to pick my genes. So if you think that it's all about genetics, there's really not much you can do about it. But if you understand the real causes, you'll have a lot more power over what happens to your health future. Less than 10% of people who are genetically susceptible to developing autoimmune diseases actually develop them. The risk changes over time. It changes when people move to different locations. There are a lot of migration studies published where you can see the health outcomes for people who live in an area where a particular disease or several diseases, the rate's very low, and then they move to someplace like the United States, and within about 15 years now, it used to be a generation, now about 15 years, you see the same incidence of disease once people adopt a Western diet. Another thing that we see, and it's very diet related, is that if you do challenges where you take certain things out of the diet, people get better. When they start eating them again, they get worse. And I'll show you some of those before we're finished here. Now, just to give you an idea on the genetics, this is a chart that will be hard for you to see, but I'll tell you what it says. What we have is a few autoimmune diseases, and we have the population frequency and then the sibling risk, all right? So if you look at this, most of them, the sibling risk is very low. So for example, psoriasis is the top one. 2.8% of the population has it. The sibling risk is 17%. But if you look at ulcerative colitis, less than 10%, 1/10 of 1% of the population has it, and only 1.2% of siblings get it. So it becomes very crystal clear. And we even have some studies with identical twins showing that the disease concordance is not very high, even in identical twins. So a lot of what this is all about is not your genes, it's about other things that affect your life. So let's talk about hormones. Androgens, or male hormones, are more immunosuppressive than estrogens, and we think that that's one of the reasons why females have more autoimmune disease than men. Testosterone has been shown to suppress antibody production in patients who have lupus, for example. Rheumatoid arthritis patients have low androgen levels, so there's a clear hormone connection. Looking at hormones, a higher lifetime exposure to estrogen increases the risk. So what we see is that earlier age of menarche is an issue. Women who take supplemental hormones, either in the case of birth control pills or oral contraceptives, and also a hormone replacement therapy after menopause, increase the risk. And women who have conditions that are related to abnormal or irregular hormone production. So women who have even PMS, infertility, heavy menstrual periods, things of that nature, PCOS, always at higher risk of autoimmune disease. One interesting thing is that changes in hormone status due to things like pregnancy and menopause change the risk. So for some diseases, when women get pregnant, the diseases go into remission, and then after delivery, they get worse. Sometimes the diseases get worse. One of my most interesting patients was a woman who had managed to keep her ulcerative colitis in remission by having 14 children. And it was a good short-term strategy, but this, menopause happens and we can't keep having babies, so now we have to actually address the underlying cause of the disease. So that was a pretty creative thing to do. I'm not sure I would have been willing to do it. You got to give her credit for effort, right? But anyway, we see that both pregnancy and menopause, depending on the disease, make the conditions worse or better. Allergies are a major trigger, and by the very definition, what allergies are abnormal immune response. This is when your immune system starts to misbehave, and instead of being interested in bacteria and viruses, it's interested in pollen and dust and animal dander. And so we take allergies very seriously in my office because we often see that allergies are the first sign of an immune system that's misbehaving. And if you don't get those allergies under control, and there are a lot of things that you can do in reference to diet and probiotics and things of that nature to calm down allergies and asthma so that this doesn't progress. In fact, one comment I can make in general about health, regardless of what condition somebody has, is part of what's wrong with medicine is that it's all about giving you drugs or supplements or procedures or something to kill the symptoms, so that you don't think you're sick, or to deal with biomarkers. But the problem is you don't get to the underlying cause, which means the person continues to get sick. And so that's one of the reasons why by the time people are in their 60s and 70s, they're taking so many drugs. The original thing that went wrong when they were 42 or 35 or whatever never got fixed. So I always liken it, I teach through analogy, if I drive home from the airport on Sunday and the oil light comes on in my car, there are a number of ways I can address it, and one of them is to pull over to the side of the road, pop the hood, and disconnect the fuse that lights up the oil lamp and keep driving. Okay, that's called taking drugs, that's called taking supplements, because we know the end of the story, the engine's going to blow up. My office is full every afternoon with people where the engine's blowing up, and now we really have to pay attention. So I don't want people to be ridiculous about every symptom, because you can go the other direction too. My elbow hurts, do I have bone cancer? I've got hangnails, does that mean something terrible is wrong? But I find too many times people ignore the fact that their body is starting to give them clear signs that they're deteriorating, and they ignore it and just keep marching along. So allergies are a trigger. And if you take a look at the biomarkers for allergy, which include things like inflammatory cells, mast cells, antibodies, T cells, cytokines, these are all the same immune cells that are involved in autoimmune. And so it is a natural progression from allergies to autoimmune, and frequently when we see autoimmune patients, they have had allergies for a long time, sometimes since childhood. All right, so I'll give you some dietary triggers, and one of them is iodine. We are always told, and this is another common theme in diet, health, and medicine, that you need more of everything, right? And you see this, that's where the supplement business has capitalized. If a little bit of calcium is good for you, then 10 times as much must be fabulous, right? And if a little bit of protein is good for you, well, eating 35 times as much as anybody should eat, that's got to be better. So one of the things that's happened is that people are convinced that they're not taking in enough iodine every day. And so they often consume supplements that contain iodine. In fact, a lot of doctors who I think are not very competent take patients who are showing signs of hypothyroidism and put them on iodine supplements, which ultimately blows out their thyroid. And we see in areas of the world where iodized salt is introduced, one of the first things that happens is within a very short period of time, the incidence of hypothyroidism starts to go up, exactly the opposite of what people have been told. The average person in the United States takes in about 1.5 times the amount of iodine needed daily, and then starts taking supplements and drops and all that sort of thing. Bad idea, actually, for a variety of reasons. Another thing is gluten and autoimmune diseases. It's a common trigger, and it's particularly common with thyroid disease. And I will show you the mechanism of action in just a little bit here. I want to make something perfectly clear, because I'll be talking a little bit about gluten tomorrow. There are people who have celiac disease. They need to avoid gluten. There are people who have something called non-celiac gluten sensitivity, and we have a good body of evidence showing that there are some people who have that. That is a very small percentage of the population. We have a lot of people who've tried to make this into something entirely different, where everybody's being told that they're allergic to gluten and shouldn't eat gluten. That's not true. One of the things that it has done, this craziness, is it has made a great market of gluten-free products so that our celiac patients and autoimmune patients actually have something good to eat, because the options used to be terrible when I first started 22 years ago. But there is a trigger, there is a connection, and I'll show you quite a few studies that show a connection between gluten and many types of autoimmune disease. Dairy and animal foods cause chronic intestinal inflammation. And this leads to a condition called leaky gut, which we're going to talk about for just a couple seconds. And what this does is this allows the entry into the bloodstream of partially digested proteins. And so we'll talk about how that leads to autoimmune disease. But we have animal studies and we have human studies showing that this is one of the main triggers of autoimmune disease. So let's talk a little bit about leaky gut, and just to tell you what it is. So your intestines are where nutrients are absorbed. And there's a huge carpet of bacteria called your gut microbiome, which is the fashionable thing to talk about these days, and that's a good thing, actually. In fact, your microbiome is made up of about 100 trillion cells, bacteria cells. That's more than you have in your whole body. Your whole body is 37 trillion. So we're going to talk about this more tomorrow. But where leaky gut comes in is that carpet of bacteria. They serve several functions. The first thing is they help you to absorb nutrients from food. They control your immune system. It's the signaling center for your immune system. And also, they help you absorb nutrients from food. So there are a variety of different ways, which I'll show you in a minute, including eating animal foods, that damage that microbiome. And what happens is these tight junctions that drag nutrients into the bloodstream become loose, and partially digested food fragments start getting into the bloodstream, along with bacteria, toxins, and a lot of other things you don't want circulating through your bloodstream too. And what happens is they're targeted by the immune system, which is the right thing to do. Anytime there's something in your bloodstream that doesn't belong there, you're counting on your immune system to trigger a response. So antibodies are created for what we call these antigens. Ongoing exposure, which is bound to happen if the leaky gut condition continues, means more and more antibodies created. And so what you end up with is food sensitivities such as gluten, dairy, that sort of thing. The development of autoimmune disease following the development of leaky gut is well known, well proven, but it's not right after. And we were having an interesting discussion before you and I in the front row, before I got up here, about the fact that you can injure yourself for a really long time with a bad diet and not know that it's going on. In fact, I have only one suggestion for an improvement on the human body by design, and I think Dr. Esselstyn would like this. I think it would be great if the interior of our blood vessels had nerve endings. And so what would happen is you would eat like really high-fat meals, and you'd be in excruciating pain. Like you'd be on the floor in the fetal position in your kitchen. You would not do it again, all right? So the fact that you can injure your blood vessels literally for years and years and not know anything going on or feel anything going on until one day you have a stroke or heart attack, that's why you have to look at this from an intellectual standpoint, and you can't afford to say, well, I've been eating this way for a long time and nothing's wrong with me, so it must be okay. Well, it's okay right now, but it may not be okay next week if you have a heart attack or a stroke, right? Okay, so what causes leaky gut? Well, meat and dairy does. Drinking too much alcohol does. And unfortunately, we still have health professionals who are promoting alcohol as having health benefits. It doesn't have health benefits. It's at best a treat. Now, if you have, like me, if you have 6 glasses of wine a year, I don't think you're going to do a lot of damage to yourself, but I have people in my office who have 3 glasses of wine every night, and you're doing a lot of damage to yourself, all right? So alcohol is a treat. It's way at the top of our food pyramid. It's not for daily consumption. Antibiotics are a big one. One broad-spectrum antibiotic can wipe out your gut microbiome in just 10, 12 days, all right? And we prescribe way too many antibiotics in this country. Now, we know doctors tend to overprescribe, but we have to take a little bit of responsibility as patients, because a lot of the doctors I talk to say, listen, I know I shouldn't prescribe so many, but patients get mad when I won't give them to them, all right? So we have to educate people not to ask for them. But what happens when you take antibiotics is they wipe out the bacteria that might kill you, or you might be able to recover without the use of antibiotics in many cases. That's a different discussion for a different day. But they wipe out your beneficial bacteria, and they cause the pathogenic bacteria to flourish. And we'll talk about that more tomorrow. Cow's milk intolerance, and you notice how many studies I have? I have probably 2,000 studies archived on my server about diet and autoimmune disease. Again, I'm condensing down. We could have 25 slides just on cow's milk and autoimmune. In fact, cow's milk is just kind of bad for anything that you don't want to get. And somebody asked me, I gave a lecture the other night about diet and health, and she said, is there anything that cow's milk is good for? I said, you know what it's really good for? Growing breast cancer. If you want to grow yourself some breast cancer, you want to get some cow's milk products and eat them every day, because that's one of the quickest ways you can get there. Patients with inflammatory arthritis. more likely to have intestinal inflammation and leaky gut. So we've looked at some of the causes. Elevated levels of antibodies to gut bacteria and to food have been found in people with inflammatory arthritis. And so this is one of the things that happens as part of this abnormal immune response. The way that, and just a preview of tomorrow, your body and your immune system should know the difference between you and not you, your pancreas versus viruses and bacteria. Also, your immune system is intelligent enough to know that the bacteria in your gut are not you, but they're supposed to be there. And so what happens with autoimmune is as inflammation levels get higher and higher as a result of doing some of the wrong things that we've talked about, the gut bacteria start being targeted too. Remember, they're the signaling system for your immune system. This is real bad for business. So let's talk about molecular mimicry. And what this is the amino acid chain of one protein closely resembles the amino acid chain of another protein. They don't have to be identical. They just have to resemble each other closely. So the way that your body works is you produce antibodies for any antigen, foreign thing, that gets into your bloodstream. And if the amino acid chains that make up those partially digested food fragments look like the amino acid chains that make up tissues of the body, we call that molecular mimicry, and that can be the beginning of your immune system starting to attack your own body. So let's look at cow's milk proteins. They're very similar to the amino acid chains that make up the collagen in human joints. And so as you get a leaky gut from eating poorly or taking antibiotics, however it happens, drinking alcohol, now you've got partially digested food proteins getting into the bloodstream, sometimes cow's milk if you consume those cow's milk proteins. Antibodies are created for those, and then those amino acid chains on the cow's milk protein look like collagen in the joints. Now you've got the beginning of rheumatoid arthritis. The same thing is true with gluten proteins and the tissues of the thyroid, that type of reactivity. So let's talk about type 1 diabetes. These cow's milk proteins not only look like the amino acid chains not only look like the collagen in the joints, but they look like the beta cells, the amino acid chains that make up the beta cells that produce insulin in the body. So here's a typical thing that can happen to a child who drinks cow's milk. Cow's milk proteins, or cow's milk was never intended for humans. Some kids don't digest cow's milk very well. In fact, most people don't digest cow's milk very well, but little kids in particular, that's why they should have formula. So one of the common responses to this is kids get infections, ear infections. Ear infections and tubes in the ears are sort of like a passage of childhood. I mean, it's just like so normal. I hear friends talking about it all the time. It's like, oh, you know, my granddaughter had the tubes put in her ears last Thursday, like everybody does it, right? Well, everybody shouldn't be doing it, is my point. So anyway, what happens, these kids get ear infections, they take antibiotics, that leads to a leaky gut. Now cow's milk proteins are getting into the bloodstream, the body starts to create antibodies to those cow's milk proteins and then goes after the beta cells of the pancreas. So how do we know that? Well, in 1992, a study was done. Blood samples were taken from 142 type 1 diabetic children, and compared to controls, 100% of the kids who were diabetic had antibodies to cow's milk protein in their bloodstream. None of the controls did. So that's a pretty good sign. And it's been confirmed by other studies. In fact, I think I've read all of the studies on this topic, and I can only find one that did not show this result. And by the way, just so you know, there are no issues where all studies 100% point in the same direction, which is why things can get so confusing, which is why it's important to have an evidence filter so that you start sorting out like the preponderance of the evidence and that sort of thing. So that's one thing. Genetically susceptible children who are weaned early, fed cow's milk formulas, and have leaky guts are more likely to develop juvenile diabetes. One U.S. study showed that children of this profile who consume cow's milk have 11.3 times greater risk of developing juvenile diabetes. That's actually higher than the risk that a smoker will develop lung cancer, if it gives you an idea. Now, we don't always know who the genetically susceptible children are, so we're just feeding cow's milk to infants and waiting to see what happens, which I don't think is such a great idea. I think if parents saw this type of information, it would cool the enthusiasm for formula. I've gotten kind of not so nice about that anymore. I had somebody the other day tell me that breastfeeding is inconvenient. And I said, well, I think if you were looking for convenience, this having children thing, bad idea. There's nothing convenient about having children, all right? You've got 18 plus years of inconvenience coming up if you do this right. The breastfeeding is such a tiny, tiny part of this, right? So anyway, this is what informed decision-making looks like. A lot of people get angry with women because they don't breastfeed, but nobody's showing women the outcomes that happen as a result of not breastfeeding. So anyway, the risk factors for type 1 diabetes are early exposure to cow's milk proteins and formula, short duration or no breastfeeding, antibiotic treatment, high birth rate, weight, and rapid weight gain. Obesity and weight gain, even in infants, is a risk factor. So let's talk about inflammation. Chronic inflammation can come from a number of places, particularly diet, and being overweight or obese, allergy, asthma, infections. And so what happens when you're in a chronic state of inflammation is the immune system is switched on. And in some people, this eventually switches on an autoimmune response. So you can be genetically predisposed and not do the things that we're talking about and not get an autoimmune disease. That's me. Every single female in my family on my mother's side had rheumatoid arthritis by the age of 50. I'm 61 and I don't have it. My sister does, and she's 4 years younger than I am. So I'm an overachiever, and I know that if I wanted to eat my way into rheumatoid arthritis, I could do it. All I have to do is start eating like my sister and my mother and my grandma. I could very quickly put myself in that situation, probably by Christmas of next year, but I'm choosing not to do it. On the other hand, you can have no genetic susceptibility, and if you have enough of this type of thing going on, you can end up with autoimmune disease. And another thing I'll say about inflammation and diet, just for a second, is that arachidonic acid is concentrated in animal foods, and it's a precursor to inflammatory hormones called prostaglandins, series 2 prostaglandins. And so people who eat a high animal foods diet almost end up in a chronic state of inflammation just every time they eat a meal. It's an argument for really reducing or eliminating animal food. All right, a couple of other causes. The hygiene hypothesis. You know, I think it's great that we're a lot more clean than we used to be. I mean, we used to have sewage running down the street. Bad idea. I get that. But we are trying to prevent anybody from having a childhood illness. We're trying to use antibacterial soap on our skin. I took a 3-hour CME course one evening on the microbiome of the skin and how dangerous it is to wipe it out by using antibacterial soap all the time. All right, so we really live in a very clean environment, too clean actually. And then another issue is antibiotics related to this. This raises serious questions regarding our current overuse of antibiotics as well as ultra-hygienic environments that many of us live in. If the bacteria within us are specific to us and necessary for normal immune system function, then it's important to know if we're in fact losing those vital bacteria. So, and we are, by the way. Martin Blaser wrote a great book called Missing Microbes. He's studied the microbiome a lot. His wife is also engaged in the same type of research, and she went to Venezuela and found a population of people that have very little interaction with the outside world. And they took fecal samples from these people and found 300 bacteria that are missing from the human microbiome in places like the United States. We don't know what that means yet, but I can't believe it's really a good idea for this to happen, right?